These are our nebulizers that we carry. Nebulizers are very popular during the winter months, so right now they're pretty in season. The way that they work is that this is our nebulizer machine. It has the on-off button. It plugs into a wall. Right here is where the filter is. So you take the filter out and you can see that little sponge in there. That is the nebulizer filter. The nebulizer kit does come with extra filters. There's 5 in here. Changing the nebulizer filter depends on how often you're using it. If you are using it for asthma and just treating sporadically, you're not going to change it as much as if you're using it 3 times a day for pneumonia. If you're using it 3 times a day, you need to change the filter monthly. If you're using it sporadically, you can usually do 6 weeks or longer, depending on how often it is that you need to use it. Right here, this is where the tubing connects to the nebulizer. The tubing that we have is universal, so either end is going to fit into the nebulizer itself. It just plugs in like that. Make sure that you have it in there with a good fit so that way it's connected properly. The next piece is where the medication goes. This piece unscrews. There's a little plastic mushroom piece that sits in here. This piece is what dispenses the medication into the machine. So it's very important to make sure that this piece is always in there. It just fits right over that center piece and screws back on. At the bottom of this piece, there is where it connects to the tubing. That just pulls right in there. So this is the main part of the nebulizer right here. The next part is optional for the patient, depending on what they want to use. If it's a patient that can use the mouthpiece, this just slides right in here, and this piece they hold in their mouth and breathe through the treatment. If it's someone who's maybe elderly or young, that they're not able to hold that piece in there, you can use a mask. There's adult-sized masks that fit right in there with the strap that goes around the head. Or, for those little kiddos, there's little masks that fit right in there, and the strap then goes around the head as well. This way, this ensures that they have a good seal around there and they're able to breathe in the medication. We recommend that after each time it's used, you use a water vinegar solution to clean it and let it air dry. You don't want to wipe it down. When it comes to coverage, Medicare will rent to own the nebulizer. They will rent it for 13 months. After 13 months, the patient owns it. That requires a prescription and a physician's order in order to get that. As far as third-party private insurances, it depends on the plan and the company if it's going to be a rental or a purchase. They typically go off of if it's a long-term need or a short-term need. If it's asthma, that's a long-term need. If it's bronchitis, that's a short-term need. So it just depends on the plan for that. It's important as a tech to go over how the equipment attaches and how it works for the patient, so that way when they get home, they have the knowledge on using the equipment properly to get the medication that they need.